Hey guys, Derm Dad here. Want to take a few minutes and talk about alopecia areata. So, alopecia areata, also known as AA, is a very common diagnosis. We see this quite frequently. Can be seen in kids, also seen in adults. And really, what you see with alopecia areata is hair loss. It can often be on the scalp. It can also be anywhere in the body, really. And usually, folks come in with one or several small areas of hair loss, and the key defining feature for alopecia areata is that the skin is perfectly smooth. The hair is totally gone in that little defined area. There's usually not any scaling or redness or any kind of rash. It usually doesn't itch or hurt. So those are all characteristic findings with alopecia areata. And you have typical alopecia areata, a small area or several small areas in the scalp perhaps, or some other places on the body. But then you can also have alopecia totalis, which is complete hair loss on the entire scalp, and then alopecia universalis, which is alopecia of the entire body. So both of those are rare. Um, Regular alopecia areata is quite common. So what exactly is alopecia areata? Alopecia areata is basically an autoimmune condition where the immune system, for whatever reason, tries to kill off the hair cells. Usually, this is temporary. It can be brought on by stress or something else that's exacerbating the condition. So, a lot of times, what we see is little kids that are under stress for some reason start having their hair fall out. Also, see the same pattern in adults. So it is autoimmune mediated. What that means is if someone has autoimmune diseases, either themselves or within their family, that is a risk factor. So thyroid type diseases, diabetes, vitiligo, all those things are considered autoimmune. So alopecia areata is your immune system basically attacking the hair cells and making those hair cells fall out. What it does not do is it doesn't kill the follicle. The follicle is still there, and the hair certainly can regrow. So that's the good news. It's considered a non-scarring form of alopecia. As far as treatments, what we want to do is suppress that inflammation. So we can use topical steroids such as triamcinolone or clobetasol cream. We can use non-steroidal anti-inflammatory creams such as Elidel, Protopic, Eucrisa, and then really the treatment that's most effective is intralesional catalog. So basically taking steroids in a vial and just injecting small injections right around the area where the hair loss is. So that's a very effective treatment. The main drawback is it can be a lot of little shots. It's not particularly painful or problematic, but if someone has a few spots, it's a good option. If they have a lot of spots, it's not. Um, for for the shots, usually we try to repeat them once a week, and usually looking at 2 or 3 months and start seeing good regrowth. With the cream, same kind of time frame, couple of months, usually should see good regrowth. Another option can be systemic steroids. So if someone's really having a lot of trouble, we can put them on prednisone, and that should help a lot as well. But the good news is, in most cases, the hair does regrow. There's always the possibility of the alopecia areata coming back in the future, so just be aware of that. But it's not difficult to treat. It's not permanent. In most cases, it resolves pretty easily. So that's basically alopecia areata. If you feel like you have something like this, I would definitely recommend going and seeing your doctor, whether it's your primary care doctor or your dermatologist, and get it evaluated, get it treated. Should be fine. So, so look, if this is helpful, definitely like the video, subscribe if you like. If I can elaborate or help with any questions, definitely put them in the comments, and I'll be happy to look at those. And otherwise, thanks for watching.